since we last met, and there's a lot of work to get done this week, so I don't want to take too much time with opening comments, but just hope and pray everybody's doing okay and that we're following our health professionals' advice and suggestions and staying home and staying healthy and limiting our interaction, which of course is very difficult to do for our people, but appreciate everybody's commitment to that. And hopefully we'll be see a little break here sometime in the next month or so. We'll see. That's all still up to the science and up to our higher power. So with that, I'm going to ask Jeannie if you would please start us out in a good way.
Oh, Leonard?
Yeah.
Okay, that's fine. That's fine.
Okay.
Okay.
Yeah. Go ahead, Jeannie.
Limlimch kulin suitin amatkin qualtigwal aki limlimch kulin suitin quatigwal gul sen qui etet chuck winks met que gul sinch tu utnet chel kush hish qua spakpak chel kush hish qua san pakam tigwel check e mistut qua na aya hen questnet limlimch kulin suitin qua tigwal ul aquat chunch atsaqual limlimch kulin suitin amatkin limlimch. Thank you for this day. Thank you for bringing each and every one of us together. We ask for guidance. We ask for strength at this time. We ask that we can make decisions that will be helpful to all of our tribal members, to our people, to our communities. So with that, we ask for blessings upon each and every one. Limlimch.
Bye.
Terry, did you have something?
No. Oh, not. I'll move ahead.
I thought you had to change the agenda or something.
Oh, well, I was going to say, yeah, we have Sharon lined up to give the prayer, but Jeannie did a great job.
Oh, I'm sorry. I'm sorry about that.
No, Sharon was good with it.
Yeah, that's great. Wonderful, Jeannie. Thank you for the
All
blessing.
right. Okay.
No, sorry
Thank
about
you.
that, Sharon. I didn't see that. Just printed it out.
Yeah, no problem. God hears us.
All right.
So Leonard,
Yes.
yeah, we can't start the meeting also without Taylor's cat being present, his 17-year-old cat. I see he got up. He must be going over to find his cat.
And shall we do roll call?
Yes, please.
Leonard Forsman, President.
Present.
Mel Sheldon, First Vice President.
President, I mean here.
Okay, President. Delno Saluskin, Second Vice President. John George, Third Vice President. Jeannie Louie, Secretary, here. Sharon Gowdy, Treasurer.
Here?
Taylor Alvick, Assistant Secretary.
Here.
And with that, we do have a quorum, Mr. President, with 5 in attendance.
All right. Thank you. All right, Terry, you go ahead and get us started with the agenda here.
Sure, we have Brian Gunn with us this morning, giving us a legislative update. Laura Platero is also with us, and she'll be giving an update from the Health Board. Aurora Lair from FEMA is with us this morning. And then we'll have state updates. Chantel Green from the Nez Perce Tribe Executive Committee. She'll be providing an Idaho update. I was looking to John to provide an Oregon update. We'll see if he gets on. And just wanted to ask Leonard if you wanted to say a few words on behalf of Washington.
Yeah, just let me know and I can give a Washington update I can get some
Okay.
help from our other tribal leaders from Washington.
Okay, and then Kevin Alice will be on with us later this morning. He'll just give us an update what's going on and what has taken place over the weekend. But before we get started, I just wanted to thank the ATNI staff for working over the weekend. I know a lot of the tribal leaders are working over the weekend as well, but when Leonard and I were notified that about the Treasury portal, Leonard wanted the tribes to get as much of a heads up and head start on preparing information as possible. So we went to work, and James got announcements out Saturday, Sunday, and Monday morning to give tribal leaders a heads up, and Elaine was verifying addresses so to update our listserv for tribal leaders. So I just wanted to say thank you to them for working over the weekend. And Brian is with us.
I am.
Brian.
Can folks hear me?
Yes, good morning, Brian.
Hey, good morning, everybody. I'll make this short. I've got to jump off in about 20 minutes for another call, but I'll just go down a short list of things, I guess, that have maybe transpired since the call last week, which I wasn't able to make. But, last week there was some email traffic about a COVID 3.5 package. I guess they call it 3.5 because it was intended to be a more limited package, at least initially, to add money to some of the SBA loan accounts that had seen a lot of demand since the CARES Act was enacted. And on the tribal side, I think there was a list of items that NCAI and other organizations had weighed in on, asking that they be fixed if there was such a package. And as it turns out, the congressional folks and the White House weren't able to agree on the package. There was differences in opinion about the amounts of money. So that didn't happen last week, but apparently talks are still continuing about trying to resolve some of the SBA related issues and add money to those SBA accounts, but they just haven't been finalized yet. I think the state of play is that with the members out of town, in order for any kind of legislative vehicle to pass, it would need to be through unanimous consent in both chambers, which is sort of difficult to do anyway, maybe more difficult when things are contentious. So House leadership is saying that they're not expecting the House to be back in session until May 4th. Not to say that something can't happen before then if there's agreement, but the kind of flurry of activity on what was going to be this SBA centered package last week ended up not bearing any fruit. But again, talks are remaining. You probably have all seen that the Treasury, Department of Treasury, had their portal come online to register for the relief fund payments. I'm not sure if folks have navigated that yet or had looked at it. It's asking for some information for tribes that are registering, name, some of the things were tribal name, number of enrolled citizens or shareholders, as the case may be. It's asking for that also if you're an ANC. The document seems to make fairly clear that Alaska Native corporations can at least register to submit this information. You may have seen, I think Kevin Alice, when he gets on the call, may talk about this. There's been a fair amount of discussion over whether ANCs are tribal governments for purposes of getting payments from the $8 billion under the CARES Act, and that's a discussion that will probably continue. But anyway, the portal page is there. It's online. If you haven't navigated already, would encourage you to do so. I think they want to have folks to have completed or submit their information by this Friday. Treasury issued a press release yesterday that indicated, at least my read of it, was that about $70 billion of the $150 billion relief fund for state, local governments, and tribes will be going out as early as this week to the state and local governments. I guess that's my read of it. I think that makes sense because the state and local governments, they get apportioned their respective amounts based on population, some kind of established formula data that they have already. So if they were going to be getting half of that total relief fund out to the state and locals, it seems like they could do so. But that was in the Treasury press release yesterday. Just moving on, just a couple other items very quickly. And this is something that I apologize if Laura has covered this, Laura Platero has covered this or maybe covering it. This was brought to my attention by a couple of my colleagues who represent, healthcare providers, non-Indian healthcare providers. But, really, and I've emailed some folks about this morning, but the CARES Act has completely separate from any kind of IHS appropriations. It has $100 billion in this Public Health and Social Services Emergency Fund, which is a fund that's administered by HHS. And essentially, these are payments to healthcare providers to offset costs and lost revenue from responding to COVID-19. I can provide Terry information, but tribal healthcare providers aren't excluded from this fund. Last Friday, HHS sent out about 30 billion of it, and they are currently trying to figure out how to spend the remaining 70 billion of it. And what they're looking at least according to what their press releases have been, they're looking at focusing the 70 billion on areas that are particularly impacted by COVID-19, rural healthcare providers, providers of services with lower shares of Medicare reimbursement or who predominantly serve the Medicaid population, and some other factors. So, this money is not loan money, it's grant money, it's direct payment money that doesn't need to be repaid. But again, with the sort of fire hose information, it's hard enough to keep up with kind of the Indian related stuff. This isn't Indian specific per se, but as I read it, tribal healthcare providers, in particularly community healthcare health providers that tribes may operate would be eligible for this. So I'll send this information to Terry so she can distribute it if folks are interested. Just and very lastly, this is not related to COVID-19, but I wanted to flag it quickly. A couple of weeks ago, going back about 4 years, you all may recall that ATNI was the author of that Indian Trust Asset Reform Act, the ATARA, which became law in 2016. There was a report that the Department of the Interior was supposed to provide to Congress about the future of the Office of the Special Trustee. As luck would have it, that report got issued during this pandemic. I've not seen it online anywhere, but I do have a copy. I'll get it to Terry also so she can distribute it. I think some of the congressional offices are requesting feedback on that report, what folks think of it, whether there's any further things to be done. But I'll just send that to Terry and perhaps she can distribute it in case folks are interested. So that's all I have, Terry.
Okay, any questions out there?
Well, this is Ron. I think the thing that I'm concerned about is, what decisions they make with regard to the eligibility of the Alaskan corporations, the ANCSA corporations. That's going to be a huge problem because that will distort whatever formula they come up with. So I saw quite a few letters going out objecting all over Indian country. I know a number of us sent individual tribal letters as well. One thing that's interesting is when I called the Interior about this topic, that Tara actually objected to it. So I think the pressure is coming from someplace else, like Lisa Murkowski or somebody else who has enough influence to try to wedge them into the 8 billion sharing. So we'll see what happens when they're going to make a decision any time now.
just to respond to that, Chairman Allen, Brian here. Me personally, I'm concerned about that also. I mean, there's, as I read it, I don't, the CARES Act uses the definition tribal government throughout. There's one reference to is a definition of Indian tribe, and that's for, who Treasury and Interior have to consult with. But it's clear that the only entities that are supposed to get paid are the tribal governments. So, if they are going down this road, it would be essentially them construing, the ANC corporate entities as tribal governments, which I think is problematic. I will say, having worked on stuff in the past, there have been, and I've shared this anecdote with folks, but I was working on the Indian Energy Bill over the years, the one that became law in 2018. And there was a biomass provision that, I would give regular updates to the ATNI conferences about this as it was progressing. But, we had this big sticking point about 6 years ago where, Senator Murkowski's office was wanting to include ANCs in this provision. But the way they were trying to do it, and they were very kind of insistent about it, was amending this definition of Indian trust land to include ANC corporate land, which is something that, we objected to because it's just not the same. We ended up getting it resolved, but, they put up a big fight about it. So, there's like, I guess, some precedent for this elsewhere, but I agree that it's troubling.
Well, if I might add one more point, Brian, and others who were paying attention to it, the argument that I've been seeing, one is your point that they're not a government, but number two, it really allows the opportunity for Alaskan tribes to double dip. The 229 tribes will get a share, whatever it is, but then they're corporations of which they are also members, and not all Alaskan natives are members of those corporations. So it's a little awkward as well. So it is double dipping, quite frankly, and I don't appreciate that as anything near fair with regard to the distribution.
And Leonard. So in the conference calls with Interior and Treasury, it was very clear that the head of Treasury that was on the calls, I forget his name right off, but he made it clear that he can't add language to the act. And he could try and be liberal in his interpretation of using payroll or number of employees in a formula, but he couldn't make language that wasn't in the act. So how would they be approaching to include the ANCSA corporations in here when all through the discussions as well, they were talking about the 580 federally recognized tribes? And so it's kind of dumbfounding that we're at this point last minute, and all of a sudden it changes potentially could change the number to over 800. And that's huge. And so I think we have to really pay special attention to this, or call whoever we have to, or take whatever steps we need to try and not have that be included.
This is Sharon, and yesterday I made a comment that again, the relevancy to this conversation. I know that in the CFR it talks about you can't be enrolled in more than one tribe to receive the benefits of more than one tribe. And I know at Yakima we do have some members who are enrolled Yakima, but they're also members of an Alaska corporation. And when asked about dual benefit, it was said that that's a corporation that's not, according to the interpretation of the language, being recognized as another member of a federally recognized tribe. And so, whatever weight that holds, I think they have to stick to the definition of whether or not those are enrolled members as opposed to shareholders for the purposes of identification of federally recognized native. And I think that's really important to kind of differentiate what you said about double dipping. I agree.
Leonard?
Yes, Mel.
Well, it sounds like we all agree, and we need to have all hands on deck to fight this. ANC corporations, not all of them have a whole lot of money, but they are a powerful group, 13 ANCs. And we need to look at all the resources we can as both as ATNI and as individual tribes, besides letter writing, to, like, for instance, call Ruben Gallego or other folks to get them on board if that's an opportunity. I don't know what the right direction is, but this is, Glenn's right. You put 800 into the equation rather than 570 or whatever it is. It changes the equation dramatically.
Yeah, 574. But Brian, can I ask you before you leave, the bill you're talking about, the 3.5 version of the stimulus, which was targeted at the small increased money for the small business loans, if I heard it right, around 250 billion or something like that.
That's
I thought
correct.
that there was other provisions in there that was going to be helpful for the tribes. Did I miss your summary on that question?
Well, I think, yeah, so Mitch McConnell released his bill, which would have simply added the 250 billion to those SBA loan accounts. And the Senate, you know, they moved to hotline that through the Senate, which was objected to by the Dems. And, you know, the Dems counteroffer was, you know, that money, but also adding some additional provisions, which I think you're referring to. And ultimately they weren't able to reach agreement over the dollar amount. The administration, it sounds like, and the congressional folks couldn't reach agreement over the dollar amount, but the talks remain ongoing. So the additional tribal provisions were, I think, communicated in a multi-organizational letter to the Hill last week. But those were not included in the version of the bill that Mitch McConnell had floated and tried to hotline through the Senate.
Okay, so the other point that I'm concerned about is the unemployment, the FUTA provision where we only get reimbursed 50%. I want to encourage you and our other lobbyist team members to keep that in mind. If we do get traction on that 3.5 version, that we want that unemployment provision corrected so we get reimbursed 100%. I do not like the idea of having to use our share of the 8 billion to deal with that other 50%.
Yeah, I agree with you completely. I've had a couple of offices just reach out to me informally asking about the issue, and I've repeated what you said. You know, for the Washington tribes, Congresswoman Delbaney, you know, is a key player here because she's on the House Ways and Means Committee, which has jurisdiction over that provision. So she would be a key person to target on this.
I just wanted to jump in real quick. I know we got to run, Brian, but I think it looks like when you look at the certification document that Treasury put out for us to fill out, and it asks us to put population in, and it says Indian tribes, citizens, members, and shareholders.
Mm-hmm.
That's a little, that doesn't sound very promising to me.
Well, especially when you read the end and they're saying that the definition of Indian tribe, they're repeating is the definition of Indian tribe, which includes Alaska village and regional corporations. Despite the fact that under the CARES Act, the only eligible entities to be paid are tribal governments. So yeah, I have a lot of concerns with that document also.
Okay, so if there's any way of altering this discussion, obviously they are well aware Indian country is against this. So I don't know what else you have any suggestions that would be the most efficient use of our time and energy.
Well, one thing, Leonard, I know that, I don't know when Kevin's coming on board, but I know they've already objected to it from NCAI. So it would be good for us, ATNI, to also object to that one. the way they captured it, I thought was quite good. I've seen some other good arguments against it, against the eligibility of them. So, and then we do have a White House meeting. Well, we got one today, quite frankly. We got a DOI meeting today on other issues, you know, with regard to the employee credit, et cetera. So we can raise it even in that context, just to get it on their radar. And then isn't there a White House meeting tomorrow? I'm drawing a blank here. I think there is, and so I just think we need to keep objecting to it. But they're going to make the call, and that money's going out. Once it goes out, it's gone, and I think that the injustice has been in. That's a done deal.
Yeah, there's a call on Thursday at 1 our time. The White House calls on Thursday. The Interior calls at noon tomorrow.
Yeah, tomorrow may be our best shot. So it's whatever we can do, and we might have to make some calls to our senators. I'm guessing Lisa Murkowski is the one who championed that agenda. When I talked to Mark Cruz, he said, I accused Tara of being having a conflict of interest. He said it was not her, that she thought it was not right for the Inc. corporations to be in, but lost that battle, according to him. So I don't know, you know, we're all trying to figure out, you know, how did it happen? But Lisa's been very close to the ANCSA corporation. She feels that they're the ones that made the difference for her election.
Well, don't leave the other senator out of the discussion either.
Yeah, you mean Sullivan? Yeah, correct.
Yeah.
He's in the mix as well.
Yeah, I think he's a pretty good sized main ingredient in the mix.
Yeah, I agree with you.
Okay.
In response to the letter, ATNI Executive Board did approve a letter patterned after the NCAI letter yesterday.
Oh, good to know, Sharon. Thanks.
Thanks, Sharon.
This is Brian. I've got to jump off the call. Thank you all for having me again,
Thank
and I'll
you,
follow
Brian.
up with Terry offline. Thank you all.
All right. Any more on legislative discussions? So we'll.
Well, you know, I do have one more. I just want to keep. We might want to have to raise this conversation tomorrow. So when you saw the 453 million being broken out on the BIA side, Leonard, there's, I can't remember, I think it's 80 million that's in GA. So we will want to know how that is being divvied up. And typically what they've done is they've gotten data on the number of unemployed people in the tribe and use that as a formula base. So they withheld a number of dollars, including 20 million, for what they deem as unexpected challenges in different areas of Indian country. As many know, for example, Navajo has a big influx of COVID-19 cases. There may be other areas. Lummi has reported that kind of issue up by Bellingham. So I don't know how they're going to use that 20 million. So the 80 million for GA, which we all need the GA money. My tribe is already running out of it, you know, because we have so many people on unemployment. And so that's going to be a big deal to get that money out and figure out how fast they're going to move on that, what that formula is.
Yeah, Ron, and that call tomorrow is only an hour, so this is scheduled for an hour. So I don't know how many
I won't talk.
get in. What's that? I missed it. All right. But I don't know how much time we'll leave for questions, but we do what we can. All right, anything else before we move on to our next agenda item, which is the health board update?
There is a question in the chat box, and it says, is there a way that the tribes can make sure that regardless of the size of our tribal members' business, that they receive the full $10,000. I recently saw that if you have less than 10 employees, you will receive $1,000 from SBA. Can anyone answer that?
Is Amber on the line?
No.
Well, I've been tracking it. I'm not sure, Melvin John, that's a done deal. So we need to, I know Kevin and his team are working, I see him on the line here, are working on the SBA rules with regard to accessing those resources. But I'm not sure that was a formula that they were toying with that they thought was appropriate. But to say the obvious that you're struggling with, $1,000 means nothing to a small business.
And we have been trying to get SBA on the line. We'll make sure we get them on next week.
Okay, thank you.
And those go through the bank. You mainly have to go through a bank to get those, right, Terry?
That's my understanding, yes.
I know on the paycheck protection, you have to go through the bank. So I don't know. It depends on the bank, though, if they're engaged or not, from what I understand. So some are more engaged than others. So we'll try to follow up on that. Okay, anything else? All right, we'll move on. Health Board. Go ahead, Terry.
Laura?
Hi, good morning, everyone. So I just have an update on the data from the Health Board. So just wanted to give you the numbers for our states and then the numbers for our Portland area tribes and what's being reported. So starting off with Oregon, there's 1,526 cases with 52 deaths. In Idaho, there's 1,407 cases with 27 deaths. And in Washington, there's 9,877 cases with 506 deaths. It has been reported through there's a site that monitors peaks. I shared it last week, IHME, and they basically have reported that Oregon will peak on April 27th, which is 13 days from now. And with Idaho and Washington, per that website, they basically have already peaked. So Idaho peaked 4 days ago on April 10th, and Washington peaked on April 6th. That was 8 days ago. So just wanted to share that information in terms of what's going on statewide. And then in terms of the Indian health system overall, IHS reported overall that there's 1,037 cases, and this was as of April 12th. They haven't updated their website in the past couple of days, or haven't yet. And then for the Portland area, we've had 633 tests done, and 62 are positive. And our epicenter is working closely to collect that data with the Indian Health Service. Only 50% of the tribes are reporting data, so we really encourage your tribe to submit the data. We are working with IHS. It's critical to get that data in because that does obviously give us a good picture of what is happening in Indian country, but also could influence funding. So we encourage you to ask your tribal health directors if they're getting that data into us. We also did a survey, or the survey that we're doing to collect the data in terms of testing and positive cases also has questions about PPE. And 8 of the 26 tribes that responded have adequate PPE, and then 80% basically have shortages. So again, this is really important data for us to gather because it really does help with the advocacy and to understand the needs in our area. We are having our 10 a.m. tribal call right after this call, and one of the things we'll be showing is the funding chart, so tracking all of the legislation and the funding sources. Just wanted to give you an update on what's available now and how to access those funds. Our epicenter did receive the 30 million of CDC funding, and we have put that out, a request for all the tribes to receive that funding from us. We have a very short application that we just needed you to complete so we can get the money out to you, and that's available now. So just wanted to, we've only received a few requests so far. It's around $60,000, so just please encourage your tribes to get that. It's a very short form to complete, and then we send a contract to you to get those funds out. And those are very specific to data surveillance, monitoring type activities. So does anyone have any questions about what I've shared so far?
This is Ron. I have a different question. What's the value and the opportunity in that HRSA money that's coming out?
The HRSA money.
If
you give, oh, sorry, go ahead, Ron.
Well, there was a notice out, there's 15 million coming out on HRSA monies, and I didn't know what, in fact, I think there's a call coming up here on HRSA money. So I don't, maybe I had the number wrong, but I don't know exactly how we would use that money or how it can be used. Do you know?
You know, it's in the funding chart, Ron. If you give me a minute, I can look it up. I don't have it right on my screen at the moment.
Okay.
Laura?
Yes.
Mel Sheldon here. What was the name of the program again that had the 60K short form available?
Yeah, it's through us, through our tribal epicenter.
Okay, good enough. Thank you.
Okay, Ron, just give me a moment until I pull up the funding chart. If you want to, Chairman Forsman or Terry, if you have something else you want to talk about just while I get that information.
Okay, I understand that there's Indian Health Service funding coming out or has been released. That's going to every tribe. Is that true, Ron?
Yes, yes, the money's out. Almost everybody should have received it.
Okay.
And yeah, the IHS money you're talking about, right? The 450.
Yeah, right.
Yeah, but it wasn't exactly 450 million. I can't remember, it broke down. Laura might know the actual number, but so everybody should have gotten that money. And the good news is that they've declared that CSC is eligible. So take your number and add your contract support cost rate, and that's what your real number is going to be.
Laura, do you want to share your screen? Will that help?
Yeah, let me try to do that. Give me 1 second. Okay, can you see it?
Yep.
Yes.
I can see it.
So here's the HRSA funding. So it's a telehealth and rural health activities set aside for tribes, tribal organizations, and urban Indian health organizations or health service providers under HRSA. Funding is for health surveillance and other needs under the HRSA Rural Health Program. And then Terry, I'll send you this document. It links to all of the information related to the funding source. And then also has information on when consultations are taking place. We've been tracking this for all of the health funding opportunities. And so you'll see, like in the, I'm sorry, Ron, did you?
Yeah, no, I got it. That caused me to ask again about the telehealth, Medicare, Medicaid rates that we want to get reimbursed at.
Mm-hmm.
Do you have any update on that status?
No, I don't have any new information at this point, Ron. That is something we're continuing to request increased rates for.
So I need to double check with Brent on my end. I think we get Medicaid rates. We don't get Medicare rates. Am I correct about that, or do you know?
Medicare rates under, I'm sorry, under,
For the telehealth,
well, you're getting a very low rate for the Medicare.
yeah, we get like $15, $16 a case, which is ridiculous.
Yeah, very
I think
low.
the rate is supposed to be more like $160. That makes a big difference, of course.
That's correct. So you'll see from our funding chart, it does have, I'll start from the top just so you can see, the health policy analyst, Sarah Sullivan at the board, pulled this together. And so you'll see that it has some of the funding that's available related to health. So it has under the sort of different packages that have gone through. So this is the first one. So you'll see here, this is that 40 million that's now available through grants. This is the one that we were very frustrated about because we asked for interagency transfer of these funds and it went out through grants. And then this 30 million from CDC, this item, is the one that went through the epicenters that's available right now through our tribal epicenter at the Northwest Portland Area Indian Health Board. It's posted on our website. So if you need any additional information about that, and I can actually send it to Terry too. We did send out an email about that, and that, you know, just to make sure the right person is getting the information to request those funds. And we made it as simple as possible in terms of, you know, not making it burdensome. And then you'll just see there's the other funding. So the 64 million from IHS, this already went out, and this is specific to COVID-19 under the Indian Health Service. And then this 70 million, I know 40 million of it, you'll see in the description, is supposed to go for the purchase of PPE and medical supplies through the IHS National Supply Service Center. So I think this chart will be helpful for you all to sort of see where things are at. We're trying hard to keep track of all the consultations and links to the funding sources.
So if I might, one of the things that our finance office and programs, in this case, the healthcare programs, are struggling with, if I can put it that way, is these monies are coming down with specific kinds of intent or purposes. And there's, quote unquote, they're supposed to be flexible, but the question of the day is how we code them. So which monies do we use for what purposes? And so when you look at them, they overlap a lot. So you see supplies and PPE in different areas, et cetera, and or different kinds of costs, salary, et cetera. So it's really, it makes our job in our accounting very challenging. So the actual job of reviewing whether or not we spent the money right is the Inspector General. And the Inspector General is actually in the office. But at the end of the day, next year, our auditors are going to do some cross references, and they may cross reference any one of these activities and wonder exactly how are those monies used. So I think we need to be careful how we handle this and what we recommend to the tribe, so that we don't get into spitting matches with our auditors or the feds on the use of these monies.
Yeah, I agree with you completely, Chairman Allen. I know that the Washington State has also issued some funding, and they're basically saying it has to supplement and it can't replace federal funds. So there's all of these layers of funds that are coming in that are going to you're going to have to track closely.
Exactly.
Terry, I don't have anything else right now, unless anyone has any more questions for me, and I can send this chart out.
Okay, great. Thanks.
All right. Thank you.
Thanks, Laura.
All right. Okay, we'll move on to FEMA.
Hi, good morning, everybody. My name is Aurora Lair. I'm a travel liaison here at FEMA Region 10. I know I've seen several of you, or heard several of you on the twice weekly calls that BIA Northwest Region hosts. So I apologize if any of this information is redundant for you, but just wanted to give you an update on what FEMA is doing, or kind of the activities that FEMA is going on right now in response to COVID-19. So as everyone knows, there was a declaration of a national emergency on March 13th. And through that, tribes can seek FEMA assistance for emergency protective measures. And that's a reimbursement at 75% federal, 25% non-federal. And tribes have the option to seek that reimbursement either as a subrecipient to the state or directly from FEMA. Currently within Region 10, which is Washington, Oregon, Idaho, and Alaska, there's one tribe that has selected to be a direct recipient, and 41 tribes have elected to work as subrecipients to the state. And I think there are two main reasons that happens. One is the states of Washington and Alaska will pick up the full 25% non-federal cost share. So tribes are reimbursed at 100% for eligible emergency protective measures. In Idaho, the state will pick up 15%, so the tribes are left with 10%. Oregon does not cover any of the 25% non-federal share. But all of the states basically pick up the administrative burden, which, as all of you know, working with any federal grant program has a pretty hefty administrative burden, and FEMA is no different in that respect. So that's pretty much what we're hearing. At this point, there is no deadline to seek assistance, and so there's still plenty. That deadline will be set once the incident period has been closed. And in the meantime, we're just encouraging everyone to continue to track all of the activities. If you have, had to hire on additional staff for enforcement of, closures or, anything like that, any additional steps that have had to take place to disinfect, your healthcare sites or elder services areas, or even, ensuring that your offices are safe for staff to be in at a socially distanced, area. Those are some examples of eligible emergency protective measures. And again, that's reimbursed at different rates depending on the tribe's status or recipient status. The other thing that has come up, and less so recently, but there was a bigger push within the couple weeks prior to this, was several tribes were interested in setting up alternate care sites or isolation or quarantine areas, and we at FEMA are able to enlist the support of the Army Corps of Engineers to conduct site assessments, which is basically technical assistance for ensuring that the tribe has everything it needs to, set up a site and, keep that site up and running. I think with a lot of the, West Coast measures, actions that were taken pretty early on, we're seeing that there hasn't been an overrun of the hospitals and healthcare facilities. And so those alternate care sites aren't as much in demand at this time. But of course, being prepared never hurts. So we, support those requests as they come in. And I think that's pretty much all I have, but I did want to open it up and be available for any questions that anyone may have.
Okay, any questions for FEMA? Have you seen any, I had a question, are you being able to get the resources distributed, or do you feel that there's anything the tribes can do to help you get the money distributed, or has it been fairly smooth?
Well, I guess depends on which resources you're talking about. I mean, there's national shortages of PPE, and that's certainly something that we're working through. And again, I think there was a pretty big push early on where people were getting really frustrated with not being able to get supplies as quickly as needed, especially with the testing kits, the rapid testing kits. Fortunately, those have started to be on the ground out in the communities, especially the rural communities that were really needing that resource. As far as money out the door, it's pretty much standard operating at this point for FEMA. It's, it is a reimbursement program. It's not a, there's no real push for it. But I guess if there are any tribes that are ready to start formulating those project worksheets and putting those expenses in, we have the capability to push those through as expedited requests. But other than that, we aren't particularly impacted by the CARES Act. The FEMA's activities and reimbursements are through the Disaster Relief Fund, which is a separate, existing source of money. So that nothing there has really changed.
All right, thank you. Any questions for FEMA? All right, we'll move on.
Leonard, can I say something first? People are asking if they can get a copy of the Health Board funding chart, and yes, we will get that sent out. And then there is it a phone call, Nika? There's something going on this afternoon at 1 o'clock our time, 4 p.m. Eastern time, with regards to that HRSA money funding the 15 million tribal set aside. So that's going on today.
I think, Terry, I think that's a CMS tag conference call on that subject matter.
Okay.
I can forward it to you if you need it.
Okay, sure. Then we can try and get that out quickly. Okay, and then yeah, we're ready to move on then, Leonard. Chantel is with us this morning. So Chantel, if you want to give a brief update on what's going on in Idaho.
Okay, can you hear me?
Yes.
Okay. Hello, good morning, everybody. My name is Chantel Green, and I currently serve as the secretary to the Nez Perce Tribe Executive Committee on behalf of the Nez Perce Tribe. So we've been working very closely with Northwest Portland Area Health Board, IHS, and the state Idaho Health and Welfare, especially on the data reporting. So with that, to date, our efforts consist of recognizing the threat, being that we're so close to Washington and Oregon a little bit earlier on. So we moved on things for before the state of Idaho because of our health disparities in our communities. So we started our efforts a little bit earlier than the state to do early in immediate orders of resolutions to establish our formal emergency response team and implementing proactive measures to aid the community. We declared a public health emergency, placed travel bans for employees. We put holds on large gatherings of events, meetings. We reduced to essential, non-essential, put into place stay-at-home orders, and implementation of increased sanitation. For our early education departments and our Boys and Girls Clubs of the Nez Perce Tribe, we closed on Monday, March 16th. And then we had temporary closures of our casinos. I'm not certain of, we're all pretty much around the same closure dates. Maybe us, I think we were the first tribe to close down our enterprises. And that was right away, I believe, on that same date of March 16th. And that is until further notice. I believe we're looking at May 1st to have an update on openings or closures to continue. So the Nez Perce Tribe continues to run its Emergency Operations Command Center under the direction of Incident Commander Marty Antone. Our incident command is currently operating at a response level higher than currently needed because of the high disparities and that meet that vulnerable population of high risk. And then we increased this, the potential for spread in COVID-19 in our area to mitigate that. The EOC team, our EOC team meets daily to debrief, discuss, and address requests. They work collaboratively with our Namibu Health, our public health, to ensure that we're helping assist our clinic with the demands that are coming in currently. Our EOC and our police department officers are working collaboratively with law enforcement agencies outside of the Nez Perce County just to ensure the safety of everybody, being that our communities are very intertwined. So, and despite the public health, our tribe is still open and operating and providing essential services to the public. We are also having, we have been having governor calls with Little. Our next call is with the governor on Wednesday, I believe tomorrow. And then we've also been having informal calls every Thursday amongst our tribal chairmen. Within those calls, they had established a finance team, responding team, so that we could be a little bit more succinct on moving our issues forward, especially with all the budget information coming forward. They established a committee that would respond to all of the needs and have a rep from each tribe. So we only have 5 tribes in Idaho. So we have a rep sitting on from each tribe. And then myself was placed on to the Idaho governor's finance team that was in charge of the 1.25 billion that will be coming to the state of Idaho. Within that, the breakout to the tribes is 30%. And then that's broken into 25% based on population based. And then the stabilization fund is at 75%. So some of the discussions for that are, a lot of it's still in the air as of right now. So they're still looking for guidance from the federal government, and then kind of looking at discussions of following the sales tax, which doesn't include tribes. So for those tribes that are on there, please respond to the emails that I'm sending to you. We're also having issues with data, and I know that was reported out from the governor of Idaho. So with a little bit of research, the Essence program, we do have data surveillance issues with our tribes not being able to get direct communication with our tribal members who live within the reservation and are seeing outside our local hospitals, whereas some of our people could be being sent home as of right now and just being guided to quarantine. That is an issue, especially if we're not knowing about it and we have all these efforts to mitigate, but we're not being notified of our people that could be positive as of right now. We don't even know if where or if they're positive at all. So looking towards solutions for that, of course, going to be working with Northwest Portland Area Health Board. And again, wanted to give a great appreciation to all of our healthcare teams who have been working tirelessly. It's been a lot of quick and fast work. So great appreciation and thank you for all of the work. Thank you.
All right, thank you. Any questions? I just want to, it sounds encouraging that you're having some positive state travel relations in Idaho, it sounds like.
Yeah, I feel like we've been working pretty well together. We typically get along with Idaho Health and Welfare. who's been pretty responsive to most of our concerns. I know the 4 other tribes did get supplies recently sent to them. So that's a good thing as well. So just kind of working, it seems like that they're looking to include, at least even for the funding that's coming out as well. That's greatly appreciated.
Right. All right, any other questions for Chantel? Thank you very much. It was very
Thank you.
informative. Yeah.
Chantel.
Yes.
Leonard, did you want to provide a Washington update?
Well, we're still very engaged with the state of Washington, of course, on a number of levels. And we've been having weekly calls with Governor Inslee and talking about opportunities and updates as well. We're working on trying to get our funding, our portion of the funding that the state's going to provide, analyzed and distributed, and working on a plan for that with the state. And that's been going okay. These things are very difficult, of course, to do. But we feel like we've got some kind of a model that maybe Ron could give us a brief update on in a second. And then I think that we've been closely engaged with the state on, like I said, with their public health efforts, and also I'm sure many of you have been also very engaged with your counties and local electeds. Here in Kitsap, we've been having weekly calls with the county electeds, or local public health doctors have been giving us updates on what's going on locally. So that's been my major experience with the state. I don't know if you have any other updates, Ron.
Well, to add to your first point, our tribal work group working with the state to allocate the 10 million out of the 200 million that the state legislature authorized. We come up with 6 options. We think we've got one that works. We're vetting that with the tribes now in Washington. And then Department of Health just issued a commitment of 100,000 to each tribe as well for healthcare COVID issues. So we're looking forward to that. And our work group not only are working on the 10 million that will go to the tribes, but the state agrees that we should get a share of the 2.95 billion out of the stimulus 3 allocation. So we'll circle back. If our formula works, we may propose a variation of it so that our tribes get a share of that as well. So every little bit helps for all the tribes, from the large ones to the small ones.
Okay, is there any questions regarding the state update?
Leonard, can you hear me?
Yeah.
Yeah, I'm just curious, just the recent announcements of the 3 governors, one California, Oregon, and Washington, on developing a plan to basically reopen the West as far as economies. Have the tribes been involved or had any in-depth discussion on what that plan may entail?
I haven't heard a whole lot other than what I've been hearing on the news about the any movement towards reopening the economy and reducing the restrictions. However, I know that there doesn't seem to be a real satisfactory approach going forward. I don't think we're going to get 100% satisfaction out of it because of I think a lot of it has to do with the testing and its accuracy. And that's a big part of it. And also having enough testing and labs available. So how do you determine what's safe? And that's going to be the challenge moving forward. But I don't know if anybody else has anything to add to that.
Well, we all know what 3 governors have done with regard to opening up the economy. and what would be the framework of it as they release the restrictions, the stay-at-home restrictions. So they haven't circled back to us. So I think that Leonard and I and others may want to engage with the governor's shop about that conversation, because we are all concerned about it with regard to our properties. Everything from our casinos, hotels, and other economic development properties that were shut down. So we don't know, Taylor. That's a good question. I'm sure it affects you guys down there, but that's also relative to construction. Construction has been hampered for those who are in the middle of their construction project, and the issue is getting to and from tribes properties by the subcontractors. So that we think we got that cleaned up, but I even found out that that there are some contractors and vendors who are hesitant to travel to our properties while they're still while we're still in the shutdown phase. There's still work to be done. So those are clarifications that need to be worked out. And we, to my knowledge, we haven't engaged with the governor's office on our views of those changes.
Okay. With that, we'll go ahead and
Can I
move on. Terry?
Sure. I just want to share with everybody that the call for on the HRSA funding, the 15 million, that if you want to write this down, I'll give you the number and the passcode. Otherwise, I can send it to you as well. The number is 866-646-8907. And the passcode is 212-4472. And that's today, and that's with HHS. And that's on the HRSA funding.
All righty.
So thank you, Colville, for providing that. Thanks, Nika.
Great. Do we have any other state updates?
No, I think I was going to tap into Kat, but I think she left the call. So if Kevin's on, so we can go to Kevin.
Okay, NCI CARES Act implementation.
Hi, everybody. So a couple consultations today on PPP and tax credits. Those are this afternoon, and they're short consultations, only about an hour and a half each. So pretty important on eligible businesses and whether, tribal governments are eligible for tax credits, and that conversation. Be interesting how that plays out, but encourage everybody to weigh in. We've heard some of the other consultations going on around healthcare and of that nature. So the biggest thing that I have been involved in our board, of course, is this issue about the $8 billion government relief fund. We don't quite know where that stands. I've been going back and forth with Dan Kowalski with Treasury on a conversation with him. That would include President Sharp, on just kind of clarifying and fully understanding what our concern is with respect to bringing in non-tribal government entities into the mix. If you all saw yesterday, OMB and Treasury and everything pushed out a form to Indian country on some information that you need to be, all tribes need to be getting their head around. That's tribal membership, numbers, population, the number of employees, and land size. You'll probably notice that they included shareholders in that, and also ANCSCA land. So that all came out before consultation was finished, which is kind of a kick in the pants a little bit, and kind of tells us where their mindset is on this. This is become a pretty serious issue. I know, ATNI weighed in on it. After NCAI, took a, initial stab at this to try to, set the record straight on what was a tribal government or not. We're really concerned about it, and I think we all should. We sent a second letter yesterday that solidified our position of, what the language in the bill speaks to when it comes to what government relief is for tribal government and what it's not. And we also spent a decent amount of time in the letter urging Congress and Interior to take into consideration, of course, the complicated situation that exists in Alaska, and allow tribal governments in Alaska to have the flexibility to use their funding that's designed to address the impacts of COVID-19 in a way that's best for them. And if that is to allocate portions to consortiums or corporations or whatever that be, that they should be allowed that flexibility, knowing that many of our members in Alaska and recognized tribal governments up there don't have the capacity to do everything, and they in a sense outsource that to different organizations and folks to do. That's fine, but let the tribal government allocate that money, and let the allocation to the tribal government be based on what the tribal government needs, and because that's the intent of the Title V of the CARES Act. So I don't know how this plays out, but from all signs that we've seen so far, it looks like that the intention right now is to include all the village corporations and regionals, which would add almost 300 entities to the existing 574 federally recognized tribes, and would, almost from just a pure weight standpoint, 2/3 of eligible entities, for lack of a better word to use, would be those that are in Alaska, as opposed to low 48. So it's kept us up all night. You probably saw me yawning a little bit earlier. I was up till 2 a.m. with folks dealing with this and crafting and strategizing and who we need to talk to, because we're in, it is 11:50 p.m. on this, and this is a serious issue. NCAI is going to be. I was actually so I was interviewed yesterday by Michelle Miller. I'm going to be on CBS this morning show on national publication Saturday morning, talking about this. Came up really quick, and Michelle Miller is Mark Morial's wife, and I've been beating on Mark Morial for a couple weeks now that he's got to help me and help Indian country get national focus to this, and he came through, and we'll be talking to NBC later today. In my interview, which was taped, and they'll work with it, I spoke to all the normal things that we've been speaking about for the last couple of weeks, but I was asked this question, about funding, and addressed it in a very diplomatic compliment, not a complimentary, but in a fashion that doesn't point fingers, but raises the issue that tribes are concerned about the breadth and scope of disbursements of funds and what impact that can have on our tribal communities and the lives of our citizens. So we had an internal meeting this morning on what kind of messaging that we're going to roll out this afternoon and over the course of the next couple of days that, makes all our tribal governments feel safe, including those in Alaska, that we're not interested in making it a ANC versus tribal issue. This is just about trying to get, dollars to tribal governments to deal with their, the things that they're facing because of this pandemic. And I'm still maybe like some of you, a little bit in a state of shock. This, as many of I was literally in my car driving home from the embassy on Friday around 4 o'clock when my phone started blowing up from board members and tribal leaders over the course of the next hour. I was looking forward to a nice 3-day weekend after working hard for 3 weeks. I told somebody I was listening to Earth, Wind and Fire, had my windows open. It was 70 degrees. I was loving life. And then this hit the fan, and it came out of nowhere and blindsided us. And I'm sure it blindsided you. And so we're trying to deal with it the best we can.
Any questions? Taylor?
Yeah. So, it's kind of awkward, and it's already come out in regards to the federal form, and I know vast majority, if not all, tribes in the lower 48 are not happy about the ANCSA issue, and I'm just curious. I mean, I know that at least one example of a tribal member that is from a lower 48 recognized tribes, because my daughter actually is a shareholder in an ANCSA corporation, but she's a member of the Cowlitz tribe. I'm wondering, is it advisable that maybe each individual tribe that knowingly have, like what Sharon was talking about, members that are also shareholders within the ANCSA corporation, that each of those individual tribes report that?
I don't know what advice to give you on that. This is so confusing. I actually received an email yesterday, which I'm going to follow up on today to confirm it. It looks like the health board and the South Central Foundation may also be considering, well, wait a minute, we're arms of these, tribes providing services to them. Maybe we should be getting distributions as well. I mean, this has just gotten kind of crazy. It's so far from the intent. We were on the phone with some members yesterday, and Mr. Cole was, at the time when I was talking to folks in his office, was on the phone with Mark Meadows in the White House, ripping them apart, is what they was told to me, saying this was not what was supposed to be happening. He's very upset. And right after a call that I had with Mr. Young's office, who told me if it hadn't been for Don Young and Tom Cole, we wouldn't have even been in the bill. And then I'm thinking, after I had that conversation, then hearing how Cole is calling the White House, I'm like, oh my God, what are these offices spinning? They're trying to spin this to me, in this manner, that somehow Mr. Cole is, cool with this. Yet then I find out, like literally 10 minutes later, he's on the phone with Mark Meadows. And then when I reached back to the person I was talking to, he actually started yelling at me and insulting the organization and saying, you guys, you had 2 weeks to review this bill. It's not our fault you missed it. And we're like, what are you talking about? We never even fathomed this when we read the bill, and when you had and wondering why we were pulling this rabbit out of our hat in the 11th hour. I said, well, we're not pulling any rabbit out of our hat. We found this out literally Friday after 4 o'clock after the consultations. I can guarantee you, had anybody on the NCAI board known about this, several of them spoke during the consultation, they would have raised the issue. But the evidence that we didn't know about this is in the fact that this issue was never raised during the tribal consultations. And what I have some subsequently found out which is very disappointing, is all these corporation executives were on the phone calls with the consultations. They were on the phone call. Also knew that the delegation addressed the Alaskans and Alaska Native corporations 2 days after the bill was signed into law, and their delegation meeting. And this has been an active discussion up there for 2 weeks with their government relations folks in the room, who were also part of the work groups that NCAI was organizing with 100, and turned out to be 132 people. They were embedded in that and knew about what was going on north of the border. And it's just maddening that, you know, we could have, had there been some kind of transparency, we maybe could have come to maybe we come to the same place, but we weren't given the opportunity to be able to address this. And then when NCAI came out with, we had an emergency meeting on Saturday night after when I was hearing all these rumors, I said, everybody take a deep breath. Let me make a few phone calls, Jake and I, to confirm this, because we're not going to spread a bad rumor. Let's confirm it. Well, we confirmed it in short order in a call that Jake had with Mark Cruz. And that's when I alerted the board that we've got an issue we need to talk about. And when the board took action unanimously, we've been hammered, and we're fine with it because, we were hammered, what is NCAI doing? They're troublemakers, all this kind of stuff, by the folks that were discovered in the 11th hour, right? I mean, I think it seems like people are mad that it came out, and it has unnecessarily caused a lot of tension between all of us and some of our friends that are in Alaska. And I'm genuinely concerned about what this means moving forward. And to those, I was speaking to a think tank last night about it, and I said, I am worried that I know that there's a dozen or so members that on both sides of the aisle, both in the Senate and the House, that vehemently disagree with this interpretation. And in future acts, whether it's a future CARES bill, which the other news is, I heard McConnell just announced the earliest that their Senate's coming back is May 4th. So now it's been pushed another couple of weeks. So who knows when there's going to be a next bill. That any kind of future action around government relief funding for tribes, if our advocates want to put in language that clarifies what a tribal government is that going to raise this issue again about kind of these two, the him versus, we versus they argument, and keep this going? And does the outflow of money in this particular situation to corporations for a government program, does that weaken our ability in the future to bifurcate the two? I mean, we've got to be thinking about these things, and so there's a lot of damage on many levels that we all have to be mindful of. But this afternoon, we're going to make it very clear that we're not trying to create a war. We're just trying to honor the intent of Congress and tribal sovereignty, and that it's a government relief fund for governments, political bodies, to address the needs of their citizens. And, that these tribes, all tribes across the country, should be given the flexibility to use their allocated funds for the purposes the best way they see fit, whatever that looks like. That's the best we can do.
Okay. Any questions out there?
Yeah, Leonard, Mel.
Yes, Mel.
Hey, Kevin, Mel Sheldon Tulalip, thank you so much for being on the front lines there. This is, to me, it sounds like power politics at its finest there, with the type of power they have up there. It just seems like all hands on deck. I mentioned that earlier, looking for the strategy. It sounds like they just got the jump on us, and how do we now create a strategy? I'm to Ron and Leonard and others, I'm ready to call my good friend Ron Dodsauer, and because you all have good relationships with Senator Murray and Cantwell. Who else do we need to touch out? And Ron has offices in 14 states. I mean, if it's all hands on deck to turn this back to help Kevin and the team, whatever we got to do, I'm looking for direction. Thank you.
Well, I agree, Mel. It is all hands on deck, but it's a moving target. And I appreciate Kevin's summary and review of the dialogue going on with Congress and administration. I just texted in the chat box that there's no way we had 2 weeks to look at the language. It was a moving target. The language kept changing on us. We kept advocating for certain provisions and resources, committed resources, et cetera. And what's happening right now on this particular topic with regard to the ANCA corporations, it's now an interpretation of the intent of the act. So quite frankly, we have some political powers. And the ANCA corporations, quite frankly, if no one's paying attention to them, make a lot of money. These guys are making billions of dollars, and they're huge in the oil industry and so forth. They're a very diversified set of corporations, all 12 of them, 13 of them. And we need to call in our political leadership and challenge them and raise the question of what's going on. Going to Kevin's point, it's intended on a government-to-government relationship, and corporations are not government. It's as simple as that. So we need to do what we can to raise the screaming level, if I can put it that way. If we don't start getting loud about this objection, then we're not going to get traction. The decision is not made yet. They're getting close, but it's not made yet. So we still have time.
And Ron, that's a great point. I found out in my, and I was, when I was at NACA, I developed relationships with some of these people, and I still have close friends up there that are CEOs for some of the regionals, and I did talk to them. And then I have folks up there that don't care much for me, which doesn't matter to me. And they are so hyper focused on 2 words, Indian tribe. Okay. And what I found out was, and I keep saying, well, that's not, there's thousands of other words in the bill, okay, that you render meaningless if you only look at 2 words. And especially when it comes to the definition of tribal government in Title V, tribal government is the recognized governing body of an Indian tribe. So when you only look at Indian tribe in that definition, you give no credence or credibility or acknowledgement to the words, well, what is a recognized governing body of an Indian tribe? And I would, for the life of me, even talking to some of the lawyer lobbyists that represent these folks, who completely ignore that and refuse to address it. And I want to look, well, why? Well, when the delegation had their meeting with these folks up in Alaska, what I heard was that the ANCs were miffed that they weren't included in the bill, expressly included in the bill. And I was told there was like this little uneasy silence. And then Mr. Young said, no, you are, don't worry about it. We got in the definition of Indian tribe as it pertains to the Self-Determination Act. So that's where this is all founded in, and it makes sense to me when that was told to me. I said, oh, now I got it, why all you folks are only being hyper-focused here, because it's like, look over here, there's nothing to see over there, okay? And it's just, and then when I heard that, they were all on the calls listening to the tribal leaders. This has really gotten under my crawl too. is they were listening to the tribal leaders, knowing that they've been talking about this for a couple weeks, because they admit that. They keep saying, well, we've been talking about this for 2 weeks. Why weren't you? And like, what? Wait, stop. And then they listened to the Great Plains tribal leaders talk about the really need to really focus on large land-based tribes and give, some apportionment based on land mass. And they listened to the tribal leaders in California talk about the number of employees, really need to focus on number of employees and all that. While they know that they control 44 million acres of land, which is, there's only about 100 million if in all of Indian country, if you consider that part of Indian country, 44 million acres of land. And as to Ron's point, these are big billion-dollar corporations with thousands of employees all over the country. So when you're putting land mass and number of employees in a formula and let the tribes make the argument for that and not say anything and know you were listening in, I'm just frustrated,
Well, and expenditures.
Yes.
The expenditures is a line item in there. And those corporations, when you look at their expenditures, including salaries, is a huge number.
It is. So, and then the one person I spoke to said, you don't understand, Kevin, some of our companies are energy companies and they're getting killed because of the low price of oil. And I said, and then in the very next sentence said, we got to make sure we can secure a reasonable dividend payment to our shareholders. And I said, stop right there. There's two problems with that. One, the price of oil being down has nothing to do with this virus. It has to do with OPEC and Russia not getting along and just putting out all kinds of oil unrelated to this virus. So I don't know why you think that. And number two, we've been expressly told in the tribes that if we're per cap tribes, we can't use this money to refund per capita payments that have stopped, and dividends to shareholders are a form of a per cap payment if you think you're going to take this money and just provide dividends to shareholders. And so there's just such a disconnect with all of this that's just very upsetting. We got to keep pushing hard, but we're trying to do it in a way that's not getting our tribal governments up there concerned, because some of these folks and tribes do need the consortiums and the corporations to help deliver services.
All right, we're going to go ahead and try to wrap this up. Kevin, really appreciate it. I think that we kind of knew these conversations were going on, but we didn't know that they were actually getting a real serious audience. And I think that that's what happened. Because we wrote it in our letter in the 8th that we'd heard something was going on, we didn't like it. And but then we found out the end of the last week that they were actually being taken seriously, which really shocked us. So we got to continue to work on that. I think it's important to remember the Republicans. We have our friends in the House. I feel we have some friends in the House that are looking out for us on a lot of issues around funding. But we know that we get left out of a lot of bills. We get left out of the tax bill. And so really we got to remember where the credit goes, because there's a lot of people taking credit for this $8 billion being in there. And as you know, Kevin, it was Pelosi's office was really key. And there's a couple other people on the Dem side. I'm not trying not to be partisan here, but we got to balance this thing out, because there's a Republican White House, a lot of people are take credit for it, when really the push and the standoff was made in Pelosi's office, from what I understand. So that we got to remember all of that it's a balanced attack here, and that we have people that are willing to hold up legislation until we're included. Just want to make that point. And I think that I'm just wondering if Congress can help in any way, or if it's, because really it's up to Treasury now and Interior. So like you said, I think Congressman Cole is a good advocate, because he definitely would have a personal relationship with Mark Meadows, who was the chief of staff for the White House. But I would think that I just don't know if there's any other key allies that we can think of that we need to call. And if you have any ideas, let me know them right now in the next minute or so.
So yeah, those allies are important, but we're working with Danes and McSally to get to, they're on the committee to get to Murkowski, because Murkowski, of course, and is a part of this, and they, you know, I'm understanding Danes is a clear, oh hell no, this isn't happening. We've got to find some Republican senators to challenge the strong Alaska senators on this issue.
Right, right. Okay. Anything else, friends? Say aye.
No, no.
Okay, good enough. Appreciate all your hard work, Kevin.
Thank you.
Okay, Terry, did you have anything else?
No, just that, Kevin, there's comments in the chat box thanking you for your work. And then just to the group, when Kevin said that the letter from the NCAI board was unanimous, that included 2 representatives from Alaska. And the last thing is that the consultation, the PPP consultation is underway. It started 8 minutes ago.
Okay, well, we'll let people go. I just wanted one last thing. I think it's important for our tribes to know about the opportunity for folks who do not file taxes to get the stimulus check. And there's a way for you people who haven't filed to get online, get an account, and get paid. So we have a lot of people that are seasonal workers or treaty fishermen or, you know, have side jobs or off the grid, as we say, are able to get the check if they are willing to sign up. So just a heads up for some of the folks out there. I have a couple people. What's that? Is that Ron? Or did you?
I said that means you, Glenn Gobin.
Right. Glenn, you haven't filed taxes in 20 years. All right. Well, good enough.
Thanks, Leonard.
Everybody. Thank you, everybody. Thanks to executive board members, Mel and Sharon and Jeannie and Taylor, Jonathan Delano, everybody for your work, and Terry and James, thank you so much for all your work. And thanks to all the presenters, and we'll be getting back together fairly soon.
Thank you, everybody.
Thank you.
All right, thank you.